5 hard tests you should or shouldn't have by the age of 50. I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my videos, like, share, and follow. Let's start out with the stress test. Now, for most asymptomatic patients, the answer is no. Perhaps there are a few exceptions, like a very high coronary calcium score or an abnormal EKG, especially what's called a left bundle branch block. But for the others, I'm going to say no. In fact, if your doctor has you doing this, there may actually be some insurance for it here. Since again, for most, it's not indicated. And many are saying, yeah, but it's harmless. Sure, until they tell you the majority of tests, which is true, those abnormal tests in asymptomatic low-risk population, well, the majority of them are incorrect. They're read wrong. Then what? Then more tests, maybe a nuclear test or an angiogram with a healthy dose of radiation exposure. And the stress and waste of your time. And then the doctor who's just made a ton of money comes out with the good news after an angiogram, it's all okay. Or we found a lesion and opened it, even though most know that putting a stent in many of these patients has no benefit and just risk. Number 2, echocardiogram. Unless there's a really good reason, a very abnormal EKG, a murmur, a suggestion of heart failure, not needed. And if the doctor comes back and tells you, oh, we found this tiny leak in the mitral or tricuspid valve, I got news for you. Most people, normal people, have tiny leaks, and it's meaningless. And then perhaps they want you to come back every year for that tiny leak. Oh boy, shameful. Number 3, carotid duplex. For most asymptomatic patients, again, the answer is no. That's sonogram of the neck. There's zero evidence that there's any benefit for standard duplex tests. And like the stress test, it can create more unnecessary tests. If your medical doctor insists you have it in their office, maybe ask them to send you to the hospital vascular lab and watch their interest in obtaining this cha-ching change. Changes, right? Number 4, coronary artery calcium score. I like this. Significant calcium score can provide a reason to either start cholesterol medicines or increase it. And number 5, cardiac catheterization. Almost never for asymptomatic patients. Now, recently, I met a patient who was asymptomatic with a very high coronary calcium score, which I like to get, for a second opinion, whose doctor wanted to schedule a coronary angiogram. And he told him, quote unquote, to take a look. It was at a community hospital that coincidentally just opened their own lab. Oh boy, remember the most dangerous word in medicine? Convenience? Anyway, they had their eyes on this angiogram, not on his cholesterol, which was undertreated for years. Unfortunately, the system rewards those who test and not who provide compassionate and honest care. I want to thank all of you for rewarding me with your kind words, your shares and follows. Remember, take charge of your health.